The Thunder Bay District has seen high COVID-19 numbers in recent weeks. Medical Officer of Health Dr. Janet DeMille says it's hard to know exactly how many cases there are due to the limited testing data that's available, but she believes the numbers are starting to plateau. Mitchell Ringos has the details.
In the Thunder Bay District, there were 103 new COVID-19 cases reported since Friday, with 243 cases currently active. Over at Thunder Bay Regional, there were 35 patients with COVID-19 in the hospital on Monday, with 6 patients in the ICU. The overall occupancy rate is 101.5%, while the ICU is 77.3% full. Dr. Janet DeMille says we don't have a complete picture of what's happening in the Thunder Bay area, but we can look at the data we do have to see if things are going up or down. And DeMille believes we may have already peaked.
I think that that's a positive sort of thing to see. Of course, it's maybe too early to make too many big pronouncements about it. But I think just from a timing perspective, I think, sort of thinking we might have peaked last week is really, I think, reasonable, and then hopefully seeing more evidence of a decline in this week as well as in subsequent weeks.
And with the long weekend just around the corner, DeMille says the health unit doesn't want to necessarily restrict activities. She just wants the public to look at their own circumstances and apply the layers of needed protection. And with temperatures rising, DeMille says outdoor activities are the way to go.
The weather is getting much nicer, and it's very safe to be outside. Even if there's COVID around, even if somebody has COVID, there's just such great ventilation being outside. So certainly, gathering together outside is a fairly safe thing.
DeMille says we do still have to be cautious around those who may be more vulnerable to COVID-19. Mitchell Ringos, TBT News.